Check out this special Wellness Wednesday on Thursday. In America, we are getting sicker while the healthcare industry gets richer. During his Senate confirmation hearing, RFK Jr. exposed a system that profits from keeping us sick. Half of the world's pharmaceutical drugs are sold in America. But are we getting healthier? Join Damon K Jones and special guest Dr. Cedrick Batchateu, the author of Self-Care Advocate, 7 Steps to Prevent Chronic Disease, as they break down what this historic hearing reveals about the war on Black health.
Peace and blessings, everybody. This is Damon K Jones here, and welcome to Wellness Wednesdays. But wait a minute, this is a special edition where we are on Thursday today, and we're going to have a conversation about the Senate hearings, the congressional hearings for the appointment of RFK Jr. To the Health and Human Services. And our special guest today is Dr. Cedrick Batchateu. Conversation. I think this appointment of Trump, whether you're a Trump fan or not, this appointment has put the spotlight on health and wellness in America. And it's put a spotlight on Black health in America when you see our elected officials not asking the correct question about health and wellness and making the health and wellness of Americans, especially Black people, making it a political football instead of addressing core issues. So I'd like to welcome to the show my brother, Dr. Cedrick. Dr. Cedrick, welcome, my brother. Welcome.
Thank you. Peace and blessings indeed, family. Thank you for having me, Brother Damon.
Nah, man, you're a friend of the show, and especially when we are discussing health and wellness, for Black people. Mm-hmm. And health and wellness is all, but, us being people of darker melanin, I think, we have to be concerned, as we was talking earlier, we got to worry about doing for ourselves. Yes. and taking care of our own health. We have enough rich history in America. We don't have to look anyplace else. We have a lot of rich history of holistic doctors or medical doctors that have been warning us for the last 50 years about our health. And we haven't been paying attention, and we've been just trapped in the matrix of following this American lifestyle, and not recognizing, what's good for them is not good for us. And, from these testimonies, we'll see, the standard American diet, the sad lifestyle is not even good for them either. Well, what do you say about that, brother?
Yes. Look, this conversation is something that needs to be had. And one thing I'm very excited about is the nomination of Robert F. Kennedy to the Department of Health and Human Services has spurred these types of conversation. Just the fact that he's known as someone who, for the last couple of years, has crusaded for food, right? Sound policies towards food. He's advocated for things like that. He's also advocated for many things with regards to medication safety, vaccine safety, which is often taken out of context and painted as a vaccine denier, all of that stuff, especially in light of the COVID-19 vaccine issues that we were going through. So I'm just very excited that people can finally have a conversation about this. And look, if there's anything we know, is that things that were once labeled conspiracies, a lot of times turn out to be right? So it's time for us to have someone to really take, a microscope to a lot of these issues, especially with regards to health. I mean, just to give you an example, in 2021, in the United States, we spent 4.1 trillion with a T, trillion dollars, or $12,530 per person. Okay, and for all of that spending, by the way, which is miles ahead of every other country on in the planet, and for all of that spending, we rank 24th in terms of longevity. Okay, we don't even have universal coverage. There were still 31 million people who were uninsured in 2020. Okay, so what is going on that we are spending more money than ever before on healthcare, but we're getting lower and lower results? I mean, you have countries out there that are spending a fraction of what we're spending in healthcare, yet they're getting phenomenal results. They're
Right.
way ahead of us in terms of access to care, the care process, and health equity, and even healthcare outcomes. There's something wrong with the issue at hand, and unfortunately, people fail to have an honest conversation about this because they see things from a political perspective. If he's Trump's nominee, well, I'm not going to like him, regardless of whether what he's talking about could potentially save my life. And I think it's a
Right.
shame.
Right. Right. Absolutely. And that, and you know, and that's what we've become somewhat so polarized, you know, that a one size fits everybody. And even if we disagree, we could disagree on certain things, but is the if the goal is, you know, let's make America healthy again, or the goal is, you know, I don't I'm not a fan of the make America great again, but if we're going to be successful, you know, as Americans, because, you know, or just black people living in America, we have to, everybody has to benefit. But the thing is, we have to focus on making it benefit for us.
Mhm. Well,
We
we
have
tend
to
to have
focus
the
on,
worst outcomes in many cases. So, yeah, you're absolutely right.
you know, I mean, because and they say, well, we're not going to work with Trump, and I tell my wife, right, and I'm like, that's stupid,
Yeah.
right? He's the president. What are you going to do for 4 years? You're just going to sit around and you're not going to work with the and not make any offer. I used to, you know, everybody knows my wife has a bakery and she does specials. You know, $400 you get this, $600 you get this, right? So I said, yo, make a like a platinum offer, $2,500.
Mm.
She's like, nobody's going to buy it. I said, how do you know if you don't make the offer, right? How do you know
Yeah,
that someone's not going to buy it if you don't put the offer out there? It's all about making the offer. So how do you know that he won't do something for black people that will benefit black people only if you don't make the offer?
you're absolutely right. I'll share a story with you, brother man. I was part of a group many years ago during Trump's first term. It was an African American group. I don't want to say the name because then you'll know what I'm talking about. Uh,
Mhm.
but it was around Trump's first term, and believe it or not, he actually had an outreach to a lot of black leaders, and some of which are here in Westchester. And
Mhm.
they had received a letter from the White House at the time stating that they wanted to have a conversation around African Americans, issues pertaining to African Americans. And I sat there and I heard the members of this organization essentially mock the letter, mock the initiative, and they never, to my understanding, they never responded with their interest of taking part in this conversation. And that, at the time, I was like, that's kind of weird. I was one of the younger members of this organization. I thought that's kind of weird because they're making an outreach to address issues directly affecting the black community. It wasn't a
Right.
minority push or a coalition of colors. It was black Americans specifically. And I was there when they read the letter. I mean, I was there. We had a meeting and the
Wow.
president read the letter to us. I thought it was a wonderful initiative, but the rest of the older brothers just said, no, 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 we're not going to be a part of this. We're not going to talk to him, et cetera, et cetera. And it just hit me like, really? Really? You are so invested into, the Democratic Party that you won't have a conversation with Trump or the Republicans who are trying to address essentially the same issues that you were trying to address. So
Right.
that to me was just like, you know what? Forget about it. Forget about it. No, I will not be part of a group that's going to, pledge allegiance to one party, um, you know, regardless of what the other party's trying to do. And that was just my opinion. But I was there when that happened. And it's to your point exactly that you won't even consider working or talking to I don't know if it's a Trump thing or a Republican thing. I really don't know, and I don't care.
Exactly. It's really crazy, that we got to the point in our politics, that we won't make an offer or reach across the line. And the reality is, as Black people, neither party has done us justice. So, I really don't understand it, but I do see which way it's going this way. And there's not, look, I don't agree with any politician, right? Right or left. I don't agree with everything that's Trump doing, but I think there's some things that he is doing that, as Black people, especially health and wellness,
Mhm.
we could take advantage of, to live a life, to live a longer life and a healthier life, and that maybe more information will flow into Black communities.
Mhm.
That we have to get off the medication, and work on lifestyle changes and infrastructure changes in our community, as
Yeah.
far as having fresh fruits and vegetables and healthy food in our community. Because if we want to talk about racism, that's racism,
Mhm.
right? That's racism by zip code.
It actually affects a multitude of people. I mean, look, you can have a bad experience with someone who may not like you. That's one thing. It's probably not going to kill you. Okay. But
Exactly.
when you have a situation where, look at the state of Black health, look at the state of Black health. Okay. You have a situation where potentially with RFK's, positions, his policies, some of the things that, he advocates, you have the opportunity now to have someone like that who wants to look at the food, who wants to talk about why people are sick, the root causes of these issues, right? Who wants to do these things. And I don't know if it's an issue where a lot of our leaders just are not aware of the food additives in our food, right? Maybe they're not aware of how food has been processed, right? Maybe they're not aware of the amount of sugar in our food. Maybe that's why they tend to repel any initiative, that's coming from the Republicans or, let's say RFK. Maybe it's an education thing. In which case, then yeah, fine. Look, let me know who they are. I'll send them a free copy of my book. Okay,
Exactly.
honestly, because
Exactly.
because you may not agree with everything RFK stands for, but I can tell you this: the previous person who held this post did not address any of these things that you and I are talking about. They didn't address the food additives, did they? No. They didn't address the seed oils in our diet, did they? No. They didn't address the sugar in our diet, did they? No. So if they didn't address any of these things, they didn't address the sedentary lifestyle and how they're killing us, did they? No. They didn't address any of these things to the
Right.
best of my knowledge. So if you've had 4 years of these people and even the ones before them, right, they didn't address these issues to this extent, right? And now you have someone like RFK coming in. You may not agree with everything, but with regards to health, I look at the man and I saw a video recently where the man is 70 years old, around there, and I mean he was
And
working
he's ripped. And he's
and he's
ripped.
fit. He was working out. He looks better than any doctor I know. okay? And he's ripped and he's in great shape. I mean, he was doing bench presses, he was picking himself up. And I'm like, my goodness, talk about practicing what you preach.
Exactly.
So
Exactly.
maybe at
Exactly.
a certain point, we have to take a hint. We have to say, regardless of political affiliation, by the way, RFK was a Democrat. Okay, so it's not like this is a Republican solution. If anything, this is more of a unifying solution. A Democrat leading an initiative under a Republican. That's how I see it. So, if you don't like the man or his initiatives because he's a Republican, then you're really showing that you're a hypocrite because he's
Right.
actually a Democrat.
Exactly.
So you can't no matter which side of the aisle you stand on, you really can't hate him based on political ideology. He never said he was with Trump on everything. Most Gabby Tulsi, she's not with the man on everything, but they
No.
understand that these are policies that we have to align on because they are for the benefit of the American people. That's how I look at it. So when I hear people, you know, uh, reject RFK Jr. not because of a policy, but because of
Right.
political affiliation. To me, they scream of ignorance or of hypocrisy. That's how I take
Right.
it. That's where
Right.
I stand. And I feel
Well,
bad.
we're gonna go into some of these. Because see, here's another thing. A lot of people, and I understand, people are busy, and they get snippets from the news and they hear with the news, and they don't have ample time to actually watch certain things. This is RFK having the discussion about vaccines, that black children should be on a different vaccine schedule than white children.
Mm.
And this is, and there's been holistic doctors like Dr. Africa that I'll talk about it after.
You were on a show on February 26, 2021, an interview with Dr. Judy Mikovits, where you said the following, and I quote, "We should not be giving black people the same vaccine schedule that's given to whites because their immune system is better than ours." Can you please explain what you meant?
There's a series of studies, I think most of them by Poland, that show that to particular antigens that blacks have a much stronger reaction. There's differences in reaction to different products by different races.
So I have 17 seconds left. Let me just ask you then. So what different vaccine schedule would you say I should have received? What different vaccine schedule should I have received?
I mean, the Pollen article suggests that blacks need fewer antigens than.
And this is so
you get the
dangerous.
same measles vaccine.
Mr. Kennedy, with all due respect, that is so dangerous. Your voice would be a voice that parents would listen to. That is so dangerous. I will be voting against your nomination because your views are dangerous to our state and to our country.
I mean, do you think science is dangerous, Senator?
So here's the deal. Here's the deal. I'm trying to stop this thing. Here's the deal. For a black woman to sit here and say this man is dangerous.
She didn't even let him finish.
Right, she didn't let him finish.
Or talk about the studies. It was just kind of like, well, no. I got 17 seconds. I got to make my point.
Exactly, brother. Like, because it's like, wait a minute. He's trying to quote studies, and you want to dismiss studies, but you don't even have to go far as the studies. You could go to Dr. Layla Africa's book on melanin, why black people are black, and he talks about how melanin in black people, we process things differently because of our melanin. He didn't say anything different than what Dr. Layla Africa was saying.
Here's what I would say with regards to these congressional hearings. First and foremost, there doesn't seem to be enough time. It's more so like when someone is trying to get confirmed, it seems to me that the opposing party is trying to take shots more so than trying to learn why their position is different than what you typically know, right? And that sort of setup prevents any new ideas from coming in or even better ideas, because if you come in with a better idea potentially, um, you're seen as sort of like a heretic, right? You're seen as sort of like out there. Whereas if you had a setup where, okay, put your positions, if they had RFK, these are the things we want to talk to you about. We want you to provide scientific evidence for why you made this statement or
Right.
why you took
Right.
this, and we will study this. We will have our own advisors who are in the medical profession, scientists, that sort of thing, review why it is, and then they can give us a rebuttal to those positions. Does that make sense? Now you have more of an intellectual conversation rather than an emotional conversation, because that was, she asked a question, he cited a study, okay, which I guarantee you she doesn't know anything about that study. Whether the study is strong or weak or good or bad, she knows nothing about the study. But her response is emotionally charged. Okay. And so it's all about gotcha. You're dangerous. You're this, you're that. And again, this isn't just with RFK, this is for anybody.
Right.
Okay. It would be better if you had asked them before these sessions, what are your positions with regards to these things and why do you take them? And then have your team review them. And if a study is bad, fine, call them out on it. Hey, our team of experts said this study was actually biased. It was actually bad. It was poorly conducted. Therefore, it has no merit. So we'd like you to take that statement back. Then you're looking at a more logical, right? A more logical congressional hearing, because now you've taken the emotional out of it. But that little outburst, I guarantee you, the only people that supported her are, let's say, Democrats. And the people so it forces people to take an ideological stand and say, well, I support her because she's a Democrat, even though she had no facts, no logical position, just an emotional outburst. To me, it's ridiculous. But again, the setup forces this sort of interaction. And that's how I look at things.
Well, you know, exactly. But then I don't know how she tries to play the race card when the study says that we are stronger. You know, it's like wait a minute. The study said that the black race was the stronger race.
Yeah.
So how do you play the race card and say is like he's dangerous to black people, to black mothers, to people like her, like she said, like me, right? When the study said, no, you're the stronger race in your genetics, which we know.
Your immune system, yeah.
Exactly, which we know, right? And you know, we got caught up in COVID because of our chronic illnesses.
Yeah. And that's another thing, right? If you look at, oh boy, even just going back to COVID, right? All of the nonsense that took place where I forget the exact number, but the probability was extremely high that you would get it and you would succumb to it if you had a chronic condition.
Right.
If you were healthy and fit, you get COVID, you know, you'd walk it off or shake it off in days, maybe weeks. But those who were most affected had a chronic condition. And so again, to me, that seems to be a wake-up call towards the chronic disease epidemic that we are facing in this country.
Exactly.
6 in 10 adults have a chronic disease. 4 in 10 have multiple chronic diseases. And those numbers are going higher and higher, because now chronic conditions affect younger children. You know, kids are obese now. It's no longer an adult issue. the number of kids with diabetes is extremely high.
Exactly.
I mean,
Exactly.
you are looking at a massive toll in our healthcare system. Within the next, I believe by 2035, we're going to have a massive shortage of physicians. A massive tens of thousands of doctors will be out of the system because many of
Wow.
them will retired.
Right.
So you are looking at, just within the next 10 years, a larger number of chronically ill patients, and a significantly reduced healthcare population due to their aging as well, retirees and et cetera, and we're not replacing them fast enough. So you're going to have the perfect storm, and that's not even including the 30 plus million people that are uninsured, that are technically not utilizing the system to the extent that they should. Right. So you're going to have
Right.
the perfect storm of calamities caused by chronic conditions. So I think that having someone put the brakes to this epidemic by looking at the food, by looking at even the way we interact with people. Does every disease require a medication? Maybe
Right.
for a
Right.
temporary symptomatic effect, but there should be a case made for a holistic approach, looking at the diet, looking at the lifestyle, putting the onus on people, saying that, hey, listen, we're giving you, metformin for your blood sugar, okay? But I'm gonna tell you this: we're also giving you a coach. We're also going to give you
Right.
something that's going to
Exactly.
put you through a
Exactly.
program. And hey, listen, if you fail to take advantage of this, that is on you. The state
Right.
bears no responsibility. You're young enough where you are, and you're competent enough to understand that these foods will spike your blood sugar. These foods are better for you, and the charge is on you, right? And so I think
Right.
that's where we ultimately have to find ourselves, where the government is actively encouraging, chronic disease prevention,
Prevention. Absolutely.
coaching, chronic disease, incorporating those programs into their approach. Because I tell you this, I'm into there's something called chronic care management,
Mm.
which is an initiative by Medicare that they began back in 2015. Okay, and the initiative is they realized that that Medicare eligible population, 60,
Mm.
65 and older, they tend to have multiple chronic conditions,
Right.
and they tend to utilize the health system more because of their many conditions. So they're going to the hospital more than young people. They're going to the emergency rooms more than young people, etc. And this is costing Medicare as well as the healthcare system a lot of money. And so Medicare, in its wisdom, created this initiative called chronic care management. And what it is, it's out of office follow-ups with patients, so that, let's say, for example, I just recently started my own chronic care management company. So we'll have care managers that'll call you once a month, touch base with you, and follow up. Hey, Damon, how you doing? Is
Right.
everything okay? Do you have anything of concern? That way rather than waiting for something to go wrong and then you having to go to the hospital, we can actually intervene ahead of time. If you need us to set up an appointment for you, we will. If you need a pharmacist to review your medications, or maybe you have a concern, we'll get that for you. If 40% of people are not taking their medications as intended, right? So
Right.
that all sorts of things as well. So that initiative by Medicare, when they did the pilot program, they found that it did reduce hospitalization uses, it reduced visits to the emergency room, and the preventative visits to their doctors went up nearly 10%. And the creme de la creme, Medicare saved almost $1,000 per patient enrolled. So even though they're paying for this additional service, they're actually saving money. So
Saving money. Exactly.
so
Exactly.
again, it falls under that preventative value-based care initiative. And so I think that that initiative should really be spread to everybody. Why wait until somebody is 65, right? Start it when they're 30 or 40 years old, right? That way you can get people used to the idea that, hey, I need to be an active participant in my healthcare instead of just going to my annual visits, my annual checkups, my annual, it's like when you go to your doctors and they say, hey, look, you have diabetes. You didn't get diabetes last night. Okay. It's
Exactly.
a process that happened over many years, right? Someone doesn't sneeze on you and you catch diabetes or high blood pressure. It is a lifelong process. And it just so happens that your body can no longer cope or suppress these symptoms. Now they're out there in the open, right? And so if we can intervene years beforehand, before these conditions happen, and we're saying, hey man, look, you haven't gone outside, you haven't walked a mile in a bit, right?
Right.
Water. If we can get people used to, again, it goes back to having someone hold your hand, coaching you, helping you out. We can make everybody a self-care advocate, conscious of their health, a willing a willing participant in their well-being. I think that's where we have to go, and I see a great opportunity with RFK because at least he aligns with some of these things we've just talked about.
Right, and for the record, everybody, we also understand this sister here, Angela also Brooks, the Democrat. She's a Democrat. She also received. We're gonna go. Everybody that has these questions that's going after him, right? He's like, brother's laughing. She received on Open Secrets. She received from health professionals $502,000 and $502,000 from health professionals. Then hospital and nursing homes, she's received another $209,000. Right, so she receives money from the industry. She receives money from people that need us on medication, that needs us sick to make money. Right, so she's on the payroll. Now we're gonna jump over to Mr. Bernie Sanders.
Yes, I was thinking about him.
Oh, of course. We're going to get into him too.
In the unusual and uncomfortable position of having to agree with Senator Cassidy's line of questioning. Mr. Kennedy, in an interview in July 2023, you stated, quote, I do believe autism does come from vaccines. And you have, end of quote, and you have praised a gentleman named Andrew Wakefield for his research. What studies, you talk about the need to be science-based, get our information, good information to make decisions. What studies have you utilized to come to the conclusion that vaccines cause autism?
I'm happy to sit down with you.
No, please, just answer me now.
Look at the Mawson study, Senator.
The what? Yeah,
Mawson, just look at that study.
Yeah, I will, and that was published.
But I don't want to, I wouldn't rest on a single study.
Right.
All studies can be better.
Okay. Don't mean to be rude, I don't have a lot of time.
Just saying
you would not be, I just heard you say you could not be happier if you were proved wrong. Mr. Chairman, I asked to put into the record 16 studies done by scientists and doctors all over the world saying that vaccines do not cause autism. Are you happy with that objection?
Look at the IOM assessment of those 16 studies, Senator. The IOM has assessed them. But listen,
let me get to it. Don't have a lot of time. I apologize. I'm happy to talk to you at another time. Don't have a lot of time. Let's talk about COVID. And I just want clarity on the issue. Again, I apologize. You have to be brief. We don't have a lot of time. Scientists have estimated that the COVID vaccine saved 3 million lives. President Trump said COVID vaccine was, what, quote, one of the great miracles of the ages, unquote. You have said the COVID vaccine was the deadliest vaccine ever made, end of quote. Was the COVID vaccine the deadliest vaccine ever made?
The reason I said that, Senator Sanders, is because there were more reports on the VAERS system, on the vaccine adverse event reporting system, which is the only surveillance system, that and VSafe. And there were more reports of injuries and deaths than any all other vaccines combined.
But was it the scientists had to save 3 million?
According to VAERS, I don't know, because we don't have a good surveillance system.
So you disagree with the scientific community that...
Oh, I'm agnostic because we don't have the science to make that determination.
Really? Okay. Prescription drug prices in America, as you know.
And by the way, I think President Trump did an extraordinary job on warp speed because he wasn't just focusing on that one intervention, he was focusing on...
He called it a miracle, but you have cast doubts on its efficacy. All right. Prescription drugs. We're going to make America healthy. I agree with you that we need a revolution in the nature of food in America, physical exercise, etc. Very, very important. But there are people who are going to get sick, and they have to go to the doctor and find out why. 1 out of 4 Americans today cannot afford the prescription drugs their doctors prescribe because we pay by far the highest prices in the world for prescription drugs. We made some progress under the Biden administration of negotiating prescription drug prices with pharma. First time that's ever happened. Now, yesterday you told me that the White House was going to issue something affirming their support for continuing those Medicare negotiations. Turned out not to be quite accurate. They came up with some bland statement, could have been written by pharma. Very specific questions. Do you believe and will you insist that Medicare continue to negotiate prices with the pharmaceutical industry so we can substantially lower prescription drug costs in America?
President Trump has made it very clear to me that he wants to negotiate.
Negotiate is a big word, Bobby. It's a big word.
It's the word you just used, Senator.
Yeah, but no, I use defend a particular law. Will you defend the law in the Inflation Reduction Act, which already is negotiating prescription drug prices?
President Trump wants us to negotiate drug pricing. He wants to lower drug prices.
So you're not telling me that you will defend the law that we passed, which has already had significant success?
Well, Congress, look, I'm going to comply with the law, Senator. Congress passed the law. I'm swearing an oath to the Constitution. I'm going to comply with the laws.
You're going to have a significant influence on healthcare policy if you are.
And I'm going to comply with the laws.
Let me just say this in conclusion, Chairman Cassidy. President Trump and Mr. Kennedy are quite right when they say that our system is broken. They're right. Our economic system today is broken. 3 people own more wealth than the bottom half of American society. Wages have been stagnant for American workers for 50 years. The economy is broken. You know what? Our political system is broken and corrupt. You have a handful of billionaires in both political parties who contribute huge amounts of money to elect candidates in this room throughout the United States Congress. That is a broken political system and a real threat to democracy. Our healthcare system is broken. And it's broken for some of the reasons that Mr. Kennedy indicated. We have not paid attention to the fact that we have massive amounts of chronic disease. We have not answered the question why in the richest country in the history of the world, our life expectancy is lower than it is in countries far poorer than we are. So I think in many ways, President Trump and Mr. Kennedy have asked some of the right questions. Problem is their answers will only make a bad situation worse. So let me ask Mr. Kennedy again. If we want to make America healthy, will you assure the American people that you will fight to do what every other major country on earth does, guarantee health care to every single American?
I'm going to make America healthier than other countries in the world right now.
Will you guarantee do what every other major country does? That's a simple question.
And by the way, Bernie, the problem of corruption is not just in the federal agencies, it's in Congress too. Almost all the members of this panel are accepting, including yourself, are accepting millions of dollars from the pharmaceutical industry and protecting their interests.
Oh, I thought that would, no. I'm a president like you. I got millions of contributions. They did not come from the executives, not one nickel of PAC money from the pharmaceutical. They came from workers.
In 2020, you were the single largest.
Because I had contributions from workers all over this country. Workers, not a nickel from corporate.
You were the single largest acceptor of pharmaceutical dollars.
No, from workers in the industry.
1.5 million.
Yeah, out of 200 million. All right, but you have not answered. Last question. You have not answered my question.
Mr. Chairman, we're 3 minutes.
How
do we make America healthy if you don't guarantee health care?
We're literally 3 minutes over here now.
Well,
how long does it keep going? At some time, you're just battering the witness.
Not
Bernie.
battering the witness.
Yes, you are. And you're getting upset at him. You're going at him just like anybody.
Listen, that's a round of applause. That was one of the best exchanges, because of the fact that, I respected Bernie, but I lost a lot of respect for him from that exchange because of the fact that, Bernie Sanders, he received, which is 2020 presidential campaign, matter of fact, for people that don't believe it, I might have to come over here and put it on the screen, because sometimes you get black people that you tell them the truth and they just don't believe it. Even if you tell them the truth, man, they just can't, get around, that they have been
Hoodwinked.
Yes, hoodwinked and bamboozled. Let me bring that down. Where are we at? Open secrets, right? So now what we're looking at, brothers and sisters, I can't make it, I don't even know how to make it bigger, but this is Bernie Sanders, right? This is his 2020 cycle. So let's see. Health professionals, he received 3,738,529 from health professionals. Hospitals and nursing homes, 3,291,718. And I don't know what the insurance companies, 1 million. Well, that's enough. That's enough, right? So he needed close to $8 million. Close to $8 million. He's gotten from the health industry. Mm-hmm. So and for him, to quote these things and got a lot of money for it, man, RFK was on point.
I think fundamentally, people don't seem to understand the power and influence of money, right? Or political action committees. And they also don't understand that a politician's primary job is to get reelected. Okay? And so if you're not going to play ball with certain political action groups, political action committees, then they will fund your opponent.
Exactly.
So whereas people tend to partition themselves according to political party, right? I'm a Democrat, you're a Republican, blah, 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 you're independent. Political action committees don't care. They will use
Exactly.
anybody. And so it doesn't matter if it's a Republican or a Democrat or even an independent, you're going to sing the tune that the people giving you the money want you to sing. And so this is why one reason why politicians will tend to say one thing going in, and once in power, they'll sing a different song because
Hmm.
they're answering to their real masters, who are the political action committees, the groups that gave them money. And so when you look at things from that perspective, my perspective is this, okay? I'm not so much interested in voting for a particular person as I am influencing them, right? So
Right.
let's come up, when we talk about black health and black positions and everything, well, when was the last time we had a political action committee that said, okay, everybody, let's get every African American,
Right.
black American to give $5. Okay, that's gonna pack a punch. And then what we're gonna do is we're gonna look at the Republicans and Democrats, and we're gonna say, listen, these are the things that we need. Which of you can guarantee us your stance on most of these, the greatest number of these? And it may just be the Republicans on a lot of these issues, right? Because I mean, just look at, funny enough, look at the support. I saw this recently. Black folks in Chicago are actually pro the position on removing the illegals because they had a couple of black folks go on the news and say they were very happy that they were getting rid of these illegals. So we're not a monolith in the sense that everything the Democrats want, all black people want.
Exactly.
Go to the
Exactly.
hood, and you have people, and there have been people that have done this. They've gone to the hoods, different parts of the country, spoken to blacks who would otherwise be perceived as being in those project areas and everything, and they run through the policies, and they support Trump's policies. It's just when you put Trump's name on them, now all of a sudden it's like, well, I can't vote for him. It's like, but that's insane. That is insane. You should support a policy that benefits you. So that's what I think. I think that it would be wiser to have a political action committee, get enough black folks to give $5-10 to that political action committee, agree on positions that benefit us and only us, right? Just like the Asians do it, just like the Israeli APAC does it. I believe the Muslims have all of these people have a political action committee, and they're not thinking about us. They're not thinking about somebody else, or another group when they take their positions. They're thinking about themselves. When we give you this money, you're going to sing the song we want. We tell you to sing, right?
Exactly. No,
Except
no. Listen, man. We might have to start one, man. Like,
it's your
no. I'm serious because I've been saying this a long time. We had at one time we had the Westchester what was it called? The Westchester Black Political Conference, and we did our first conference, and we had a panel. It was like it was from 11 to like 4, right? We had 2 panels, and the keynote speaker was Dr. Lenora Falani. She was the keynote speaker, and people got so scared. And black folks, we had more white people joining than black people. I was told that the black Democrats had a problem with what we were doing. It's like why would you? Like, why would you have a problem with what you're doing, what we are doing? When we're supposed to, the only reason you have a problem with what we're doing is the outline and agenda that we had didn't match yours.
It didn't match yours, yeah. And
Right. That's the only reason, because if we black people, right, what we want, we want jobs, we want economic development in our communities, we want reparations, we want a list of things. So the only way that you will have a problem with what this organization was doing is that our goals wasn't your goals.
Of course. I mean, that clearly that's the issue at hand. And so you now realize that just because somebody looks like you doesn't mean that they are looking after your best interest. Just because listen, if I only see you come election time, okay, come election time, you want to come out and tell me how much you care about me and everything, then look, it's 2025 rather. I know the grift, okay? You're not going to string me along. And look, if there's one thing that Trump has shown, and this is what in a way, I'm very happy about this. They called this man Hitler. They called this man racist. They called this man every name in the book, things that would crucify any politician. They don't want to be called a racist,
right?
Let alone Hitler, let alone a Nazi, let alone, racist, let alone, just, they don't want to be called. Trump's been called everything. And it doesn't matter. And I feel like
exactly
it doesn't. Think about it.
He said, "Oh, he has 35 felonies."
It doesn't matter. The mugshot they took of him got him more black votes because they went around New York City interviewing black folks, and they were happy. Some folks were saying, "Well, he can relate to me now," right? The point being is those things that politicians typically shied away from because, a politician, they don't want to be mislabeled or called.
Exactly. He welcomed it. He welcomed. That's just such amazing. That's why I tell people. I said, look, if you look in the Bible, before God straightened anything out, He created chaos. Mm-hmm. Before He straightened anything out, He created chaos. This is how you know we're in the time of God. Because it's a lot of political chaos, the social chaos. If you look at what's going on, if anybody's watching, just pull up the Democratic National Committee chairman.
I saw that.
Wow. Really, really, wow.
Yeah.
And I said, the Democrats will never win a national election with that committee. It's
not with
over.
That nonsense. I mean, they're still going on with the stuff Americans rejected soundly. They're still talking about this. That they're not talking about jobs. They're not talking about this or that. Nope. Listen. Don't get me in trouble.
Yeah, we gonna get into this next Negro, Raphael Warnock, and I want to tell you, man, Martin Luther King Jr. is rolling over in his grave, and maybe his children might disagree, but this was horrible.
Yeah, I was not comparing the CDC to Nazi death camps. I was comparing the injury rate to our children to other atrocities. And I wouldn't compare, of course, the CDC to Nazi death camps to the extent that any statement that I made has been interpreted that way. Yeah, I don't agree with that. In 2003, the United States Congress Government Oversight Committee ended an over a year investigation of the CDC and used almost that same language. They said that the CDC, just one division, one branch, the Immunization Safety Office, had put institutional self-interest and pharmaceutical profits ahead of the welfare and health of American children. So that was a conclusion by Congress. And I repeat that.
I'm asking you because you're the nominee for HHS. It sounds like you stand by those statements.
Senator, my objective is to support the CDC. There's nothing I'm going to do that is going to harm CDC. I want to make sure that our science is gold standard science, and it's free from that same Government Oversight Investigation Committee, that the panels, the ACIP panel within CDC, I think 97% of the people on it had conflicts. I don't believe that that's right. I think we need to end those conflicts and make sure that scientists are doing unobstructed science.
So I want to enter this statement, by the way, into the record without objection.
Without objection.
Last week, the White House gagged HHS and the CDC, preventing them from communicating all important public health information to anyone, including all of our allies, including our allies in the United States and global disease prevention. Can you just answer yes or no, because I'm running out of time? Do you agree with that action?
I was not consulted on it, but that's pretty much standard operating procedure for incoming administration.
So you agree with the action that gagged HHS and CDC from communicating important public health information?
That directive made sure that no public health and only non-essential travel and mass communications were temporarily suspended pending the confirmation of a new HHS secretary. This is standard operating procedure for every administration.
I get it. I don't think what we've seen over the last several days is standard operation for new administration. I think we're seeing some unprecedented actions, but you agree with it. Last night, members of the CDC, along with other federal employees, were actually invited to resign, these buyouts. And I got text messages and folks I know work from the CDC, for the CDC, that do this important work, who got that note. And it's really important because my experience is that when you send out that kind of note, the folks who resign are the folks who you least likely want to see resign. They got other options. They're gifted folks. They got a lot of expertise. They have options. A lot of them are doing this work because of their patriotism, because of their commitment. Do you agree with the buyouts that were presented to CDC employees just last night?
I agree. At the vast majority of the scientists and experts at CDC are patriots of good government service.
Can you tell me yes
I don't
or
think
no?
anybody's going to resign who's committed to making America healthy.
Can you just answer yes? Okay, you agree with the buyouts. In our meeting, I asked you to confirm your support for the Affordable Care Act. You also mentioned that you and President Trump want to fix the ACA by making premiums more affordable. Can you answer me yes or no, as I don't have a lot of time? Did you know that tax credits that help families afford health insurance and save Georgians an average of $531 per month per person are set to expire at the end of the year? Did you know that?
I do.
We need to move on.
Do you support Congress extending these tax credits so that Americans can continue to afford health care?
Congress has to make its own decisions about that. My instructions from President
Chairman,
Trump
you're saying I'm running out of time, but I'm having a lot of trouble getting the witness to answer yes or no to a yes or no question. Well, and I've got one more question.
You're almost at 9 minutes, sir.
Well, I need him to answer yes or no. Yes or no?
I'm not going to answer yes or no to a question that's not susceptible to an honest yes or no answer.
We need to move on.
I think that the fact that you find it difficult to answer basic questions is deeply troubling for me as you present yourself as a nominee to run HHS. Thank you so very much.
Senator Smith.
Let me tell you something. I never saw so much Negroism in my life.
Circus, Afro circus, Afro circus, Afro polka dot, Afro.
That's what that was. You got to be kidding me.
Yeah.
You know what I'm saying? And for a pastor, this is one of the reasons pastors should not be in politics, because God is watching your bullshit. I'm sorry.
Well, I'll say this. First and foremost, let's not blame his pastoring. He's a politician. You know what I mean? Like that's the hey. Treat him as a politician, right? Give him all the dues that you would pay a politician. Don't look at him as a pastor. Because you know why? Because you know why? Again, it goes back to, okay, if you were just like you and I are sitting here and we're discussing, health, the healthcare system, the state of Black health, for example. Okay, at a certain point, you have got to look at the state of health that we're dealing with all the chronic conditions. And common sense would say, well, look, we can continue to spend this money on it, or we can look at what is fueling the fire. And if you have somebody, let's say like a Robert F. Kennedy, outspoken as he may be, if he's interested in addressing the root causes of this fuel, okay, of what's fueling the fire, then you would change your questions rather than making them political or trying to score those hit points.
Mm-hmm.
Your job would be, hey, how can, what exactly are you going to do? Tell us so we can know, we can prepare, we can support you, or maybe even we can oppose you if need be. But we want to know specifically what your intentions are. Because a lot of these hearings were pretty much, well, you once made this statement, right? Why did you say that? Well, it's offensive. I think it's dangerous. They're trying to score hit points. Okay. Well, look, the last secretary of the Department of Health and Human Services was there, and chronic diseases just kept going on up, right?
Exactly.
So is that what you want? Do you want just a continuation of what hasn't worked, or would you rather have someone that's going to say what's being put in our food that's causing these things, right? Someone to say, hey, look, I'm 70 years old, and I can bench press, I can do this, I'm in great shape, right? Maybe you should aspire for that. That's what someone with logic and common sense would say. What you're seeing with a lot of these politicians is they're batting for their team.
Right.
And it goes back. I mean, look, if you were to look at Raphael Warnock on Open Secrets, you would find a lot of the same things.
Oh no, we get ready to bring, brother. I'm glad you brought that up. We're about to go right into it.
But that's why I said leave the whole pastor out. That's a politician. Okay, don't be fooled by the pastor. That is a politician. Okay.
So health professionals, he's got 3,648,925 from health professionals. Let me see. Hospitals and nursing homes, right?
Mm-hmm.
847,722. Now remember, this is, I think, this is the second or third term. So he's new. He's not up there yet, right?
Mm-hmm.
Pharmaceuticals and health products, 761,478. So he's on the payroll too. And just like you said, brother, he's in Atlanta, which has one of the highest AIDS rate. And he had got one question to RFK about how do we deal with this AIDS epidemic that's going on in Atlanta right now.
Right now, yeah. Nothing about that. Nope. We just got to score political points because
exactly. Not only that, and we're gonna go to the pastor side too. You a pastor? I ain't gonna let him go from that. You a pastor, and you didn't even ask him. The study that came out a few years back that Black men that attend church regularly were the most unhealthy, and you didn't even say, how do we fix that in the Black church? What would be your plan, Robert, to fix that in the Black church? You went on to Negro pandering and try. Listen, our Black elected officials, if people are not, if you don't see this right now, and if you just so blind about what's a D and what's a R, then you need to take the blue or the red pill, one of them pills, I forgot which one it was, and get out of the matrix.
Yeah. Yeah. Well, look, he's just serving his master, and the master are the donors or his political party. That's why I said, look, man, miss me with the pastor stuff. Okay. I no, no. Why? You know why I say that? Because you cannot just believe what someone says. You have to believe what they do.
Right.
Okay? Just like you were able to see his priorities better than he was at that particular Senate hearing.
Exactly.
Right. So how is it that you, being all the way out here, can see some of the things that he should have asked the potential Secretary of Department of Health and Human Services? How is it that you could see some viable questions to ask, but he didn't see them because he's trying to score points for his masters? And
Right.
and so that's why I said, look, man, leave the pastor alone, okay? leave that out of it.
I really, as someone who is trying to get closer to God, and I even told my pastor this. I have a problem, and as a black man, as a husband, as a father, as a grandfather, I really have a problem with these pastors and how they're taking us to hell on a rocket ship because of politics, because of money, because of just social status. And our communities are just literally getting worse around their church. And my mother told me, God bless my mother, man. She went to church every Sunday. She was up on her tithes. She had a one special seat. When she passed away, her pastor said nobody sat in her seat. Like they knew that was her seat. You know what I'm saying? To the day of her funeral, they draped it with a white thing where she sat at every Sunday. She said to me, she said, because I was, sometimes, man, when you deal with black people, it will send you to depression.
It's a sad state.
Yes. It will send you, when you deal with our sickness, our mentality here, it will send you to depression. And one day I was having this conversation with my mother, and I just didn't understand, and she said to me, she said, it's not God. It's not God's, paraphrasing. She said, it's not God that doesn't like the communities. It's the pastor's connection to God. They don't have the proper connection to make the right change in the community because they're not doing it from a God standard.
I'll give you a good example. Let me give you a great example of why you should test every spirit. Okay, and a title does not make a man.
Exactly.
I do the self-care advocate workshop,
Right.
and it's a 3-hour workshop. It's got books, workbooks. It's very interactive, and I visited a congregation up by me, and thereafter the preacher said, "Listen, we're trying to get." We need to get more people, more outreach, folks to come in the church, that sort of thing. And, we're looking for ways to doing this, blah, 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 door knocking, that sort of thing. I came up to him and I said, preacher, here's an idea. Okay, I got this workshop thing. I don't mind doing it for free.
Right.
I'll set it up at your congregation free of charge. And, you just have to invite the people, right? It's not interfering with worship or anything. It could be done on a Saturday. You just invite as many people as you can. They'll come in. They'll benefit from the workshop, right? Diabetes, high blood pressure. We're going to address those things. And then thereafter, you can give them a church track and everything. That was my way of helping the congregation. You know what? He texted me later on, and he said, "Hey, look, I appreciate the offer, but I the church building should only be used for the preaching of the word." And I said, okay.
That is the word.
Listen. I politely bowed out. And I said, okay, then it's not my home church. I was visiting. So I said, look, I try to help. I try to help the people. I try to help, the members of the community. And if you believe the church building belongs to God, you have not read the Bible. We belong to God. The church building is our building. We pay for it. God does not pay for it. By the way, everything I'm saying is 100% biblical.
No. And you're right, brother.
It's
And
a
not only
building that belongs to us. We use it for the glory of God.
that's
It does
right.
not belong to God. There's nothing in the Bible that says the church is a building. The church is a people.
That's right.
And that building is not God's building. It's our building for the glory of God. If we stop making payments, the real owner, i.e. the bank, is going to show us who.
Exactly.
I always found it funny that, if you went to a church building, and you started graffitiing on that, they would stop that, man. You can't treat this building any old way. But that's a building.
Right.
Okay. But what about the body?
Exactly.
Right? The body is the temple. The building is not the temple. You can call a building a temple all you want. God does not dwell in temples made with hands. Okay. He doesn't dwell in them.
Exactly.
The temple is your body, and we are sick physically. And we are dying in our 40s and in our 50s. I think a rapper just died at like 54, Irv Gotti or something like that. 54 years old, right?
Yeah,
And,
and exactly.
I mean,
But he said some real and for all that's watching, I send my prayers out to the Gotti family, the whole Murder Inc. family. But we've known he's been battling with diabetes for a long time.
Right.
And one of the interviews that he said, which I wish that there were people around him that would have got him to the right people. Because when he said it was genetics, I was like, oh, this brother was misinformed.
Yeah.
You know what I'm saying? This brother was right there when he said it on an interview, when he was on the interview and they was asking him about his health, he says, well, it's genetics. I was like, oh, this brother right there was misinformed. So you have people that are high stature socially still misinformed on what do we do with our health.
Yeah.
And there are pastors that are misinformed that they don't make the connection to health, wellness, and their faith.
Oh, yeah. Well, look, we see this because, again, as someone who grew up in the church, someone would die in their 50s and 60s. We'll say stuff like the Lord called them home, right? That is not even scriptural. To that I say,
exactly.
The King himself, Jesus said, the harvest is plenty, the laborers are few. He
Exactly.
has absolutely no need for you to die and go to heaven. He needs you here on this earth.
Exactly.
And so
exactly.
These statements are said out of ignorance. And I've spoken at my fair share of churches. And I'm glad to say that the pastors that have attended to my workshops, their minds have changed. They are now aware. Yeah. They are now aware. I don't know to what extent it's going to continue because I'm not there every day. But at least when I finish my workshops, my seminars, they now understand that it's not God that's killing you and it's not the devil. Okay?
Right.
Stop taking things that happen in the Bible and applying them to yourself today. Okay?
Exactly. Exactly. Exactly.
And the devil is not giving you diabetes just to test your faith. It's your diet. Okay.
Exactly.
Diet. So, but I mean, how do you multiply that impact? You've got to speak to a forum of pastors, a forum of preachers, a forum of ministers, a forum of leaders, and let them know you have the power of life and death in the choices you make each and every day, the foods you eat, really letting them know that, hey, look at the foods that we've been feeding. Look that we've been feeding our children, feeding ourselves. Look, one of the reasons why I'm a big fan of Robert F. Kennedy is that I believe, and he's said this before, his statement, he's gonna make this a public conversation about seed oils, right? Canola
Absolutely.
oil and all these rancid oils that most Americans are eating.
Right.
And killing us, the inflammation that it's causing, right? Just canola oil, cheap.
Right.
Let me make a statement, a public statement on that, and let people start digging in and start looking at what these oils do. It's in my book, Self-Care Advocate, 7 Steps to Prevent Chronic Disease. But let him make that statement and have people start looking. Let him talk about the amount of sugar Americans are consuming and how sugar is in everything. You can't even give a snack to a kid without, 10 grams of sugar in there.
Right.
Women are
No.
eating 3 times as much sugar. Men are eating 2 times as much sugar than they should. And so we act surprised when in our 30s and 40s, we're diagnosed with diabetes or high blood pressure. We act surprised when, the writing was on the wall. And so I hope that Robert F. Kennedy can bring that revolution by bringing it to the forefront of conversation. It doesn't even need to be policy. He simply has to make that statement.
Right.
Okay? And force people, a lot of people, might not agree with him because of political party, but enough people are going to Google it. They're going to look into it. They're going to look at books, they're going to look at interviews, they're going to look at podcasts that I've done, that you've done, and they're going to see, wait a minute, why is this all over my kitchen cabinet? Why is this in our food? When we've known that it kills us, we've known that it causes inflammation, it compromises our immune system. And so now you're seeing people start to realize that, wait a minute, it's not a left and right issue. It's an ignorance and knowledge issue, right? There's certain people that want to remain ignorant of what's going on. So they'll bring up every other topic. So if someone has a good solution, they'll call him a racist because, that immediately builds a wall, right? Because he's a racist after all. So that's why I said the good thing about Trump that I've observed and that he's done is that name calling really no longer works anymore, right?
No.
I'm going to stand on this position. You can call me an Uncle Tom. You can call me, whatever you want to call me. It really makes no difference, right? This is bad, and you can like it or love it, but that's the position I stand on. And that's what I hope will become of Robert F. Kennedy's nomination, just bringing these conversations to the forefront of the American people's thinking pattern and having people start to look at things, the foods that we're eating. Let them know that you can be 70 years old and in great shape. Let them know that dietary and lifestyle changes, right? Though uncomfortable, once you make them, you are no longer a victim of circumstances, genetics, your mama, your culture. You are now in charge of your health, and you can have whatever end goal that you desire for your health. I'm going to tell you this. I'm 35. I have no chronic disease. I take no medications. Praise God. But that is not because God has blessed me. It is because of the deliberate choices that I've made. God has blessed me with wisdom and a desire for wisdom.
Right.
And so I have used that wisdom to learn how to keep myself healthy. But I make these choices each and every day. And you can too. Being Black doesn't stop me. There's no conspiracy to keep me. Look, I spend a little bit more. I buy extra virgin olive oil. Just that simple change, right?
Exactly.
Yeah. I make an effort to drink water and not drink soda. I haven't had soda in Lord knows how long, right? So I make these changes, and while rough at first, they become habitual. And once they become habitual, boom, you don't even have to think about it. You see what I mean? And so my health is a product of my thought pattern, my choices, right? It's not about I come from good genetics. God loves me more than he loves you.
Right.
It's the pursuit and desire of wisdom as it pertains to living to be 100 years old without any medications, without any chronic conditions. That is my desire. And I'm certain that that will be what will be in my life. But again, most people do not have that certainty because they lack the knowledge. My people perish for lack of knowledge.
That's right.
And it gets back to that. But we're distracted by politics and scoring points and, all of that stuff. So, I think the good news is that people are no longer sensible to these agitations. Oh, he's a racist. Oh, he's this. Miss me with that, man. I'm trying to get to the solutions.
Exactly. Let's get this last one, brother. This last one, Senator Warren, and we're gonna finish up. So we're gonna get another good, interesting show.
Kennedy, I want to start with something that I think you and I agree on, and that is that Big Pharma has too much power in Washington. You said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit?
You're not going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh. Yeah, I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this
I don't think any of them want to give me money, by the way.
Let's keep going. You're right because to say yes, because every American has the right to know that every decision you make as our number one health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. I do want to clarify something because you're making me sound like a shill. I put together that case. I did the Science Day presentation to the judge on that case to get it into court.
Mr. Kennedy, it's just a really simple question.
Yeah.
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're a secretary and for 4 years after. It's just...
I'll commit to not taking any fees from drug companies while I'm secretary.
No, I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies.
No,
and I'm not going to agree to that,
drug
Senator.
companies as much as you want.
I'm not going to agree to not sue drug companies or anybody.
So let's do a quick count here of how, as Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You can publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You can appoint people to the CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You could change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS. And I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits so that what you do as Secretary will also benefit you financially down the line.
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me, Senator, you're asking me not to sue vaccine pharmaceutical
am
companies.
not. My
Yeah, you are. That's exactly what you're doing.
Look, no one should be fooled here. As Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
Before we go to Senator Tillis, I think.
Yeah.
You know, him suing pharmaceutical companies, and we come to find out when people go to open secrets, like this is amazing here, how, you know, God just puts the truth out there, man, and it's, you know, God puts the truth out there, brother. This sister here, and people that are watching, you know, I always said, if you want to know your priorities of your politician, whether it's city council, it don't matter what level of politics it is, right? Mm-hmm. Look who gives them money.
Yes.
That's who they're loyal to, is the people that give them money. See, little Ray and Junebug and Auntie and all them, they don't give this type of money.
No. Just go out and vote.
Exactly. Healthcare professionals, 2,336,613. I'm gonna go down. Hospital nursing, she gets over 1,600,888. MISC Health, whatever that is listed 644,000. Pharmaceuticals and health products, right, which she was worried about him suing, right, 625,580, and health services HMO, 597,900. So the list says what she got total from health was over $5 million in the 2020 cycle. Mm-hmm. So this sister here is worried about, is focusing on him suing pharmaceutical companies and health companies, which she gets money from. This is the hypocrisy in politics, and this is the hypocrisy in American health.
Yeah.
It's sad, bro. It's sad. It's sad.
Protect your masters, and that's what it comes down to. At this point, you know, I still think that there are people out there that have pledged allegiance to a particular party rather than policies, and it's sad. You really can't do anything for them except to wait for them to come to their senses. But what I love that you and I have been doing, especially you, with looking up who's contributing and everything. When you see where the money comes from, then you see where what has inspired the types of questions that were asked. With back to a Senator Warnock. You asked, hey, you're down there in Georgia, Atlanta. With the AIDS and HIV, why not ask a question pertaining to that? Well, they're not giving them that much money compared to, you know what I mean? So of course he's not going to ask. He's trying to score points, and that's what people have got to come to the understanding of. Okay, if you want a politician to serve you, you've got to understand there's strength in numbers. Get like-minded people, take a position, and then fish for whichever party is going to adhere to those, to that position, and go with them, right? Rather than a blanket statement of, nope, we're not going to talk to these guys. We're only going to talk to these guys. Okay.
Exactly. Exactly.
Why,
Exactly.
I just want to wrap it up, going back to what we started with. We sit here and we wonder why our politicians of times past have not actually addressed the issues that we're facing today. Why things got so bad in healthcare that we are now, right here and now, at this precipice, at this very moment, facing a deluge of chronic diseases, right? It should come as no surprise because that's how the game's been played.
Right.
Okay? Going forward, we can be held accountable for, because we're the ones voting, we're the ones supporting these people, we're the ones voting for them, just listening to their speeches and everything. Going forward now, you cannot plead ignorance. There's all these websites out there, Open Secrets, etc., where you can see who gives money to these politicians. If you choose to be ignorant, that's really on you. But
Exactly.
going forward, I choose to be educated and informed. I have no allegiance to these people or these parties. I go and I will support anybody whose interests align with mine. And right now, because the previous Health and Human Service Secretary did not address the issues of chronic disease from a dietary and lifestyle perspective, I'm open to anybody. RFK, that is. I'm open to see what they're going to bring to the table, because at least, at the very least, I know they are aware of the issues, right?
Right.
Whatever other positions they take is not my problem. It's not my concern. I just want this to be addressed. You see
Right.
what I'm saying? Because the last
Right.
people did not even address these things. So miss me with them and their time. It's come and gone. I
Right.
want someone who's going to address these things. And if he can deliver that, God bless him.
Yeah. Well, I think he can. And we're going to see, and we're going to see, and I think it's but that does not excuse us from continuing to make health and wellness in the forefront. It doesn't excuse us to keep educating ourselves in health and wellness, to keep using our kitchen as a medicine cabinet, as a place where we keep the family healthy, educating men and women, but to me, especially women, because y'all are the maintainers of the children. And you have to know how to, sisters, I don't care, man. Y'all got to learn how to cook. These new sisters that we are producing in our Black community that don't know how to cook, that don't know how to make a meal.
It's a cultural thing, and
yes,
believe it or not, I see this shift in other cultures as well. The whole feminism, that sort of thing. That's all I'm going to say on that. But yeah, you're seeing that.
They got to learn how to cook, man. They got to put home economics back into school, because the home, sisters, the home ain't your place. The home is your base.
Well,
the home. You got to cook for your children, because the children are part of the reason children are getting sick is because what the parents put on the table for them to eat.
And I think it's also a difference. We have to remove this perspective that, being a feminine woman, right? A homemaker, it's bad, or, this image of the boss chick and, all these shows that show these women like, oh, I'm this, I'm that. Man, please. The happiest people are the one. Look, my prayer is that I can retire my wife, and
Exactly.
she can be a stay-at-home mother and just focus on giving me more children and raising them.
There you go. Look, hey man, I gotta hold on a second. We gotta put applause to that, brother. See, because
that is my goal. That is my goal in life.
Men don't understand.
Yeah.
Men, healthy men, they have that in mind. Like, I don't want you to do all this. Right? I get in arguments with my wife. I was like, all right, you got your business, you got that. I said, you retire in 6 months. That's one job down. Right? Now you got your business. I'm focusing on getting a lot of money so you don't have to do that.
Yeah.
Right? So you don't even have to do that. So like healthy men, that's what they look at for their women not to work.
Yeah.
Unhealthy men is worried about what job you have. Right? You understand? Because if you're a man and you ain't worried about what the woman make, you ain't worried about none of that. It helps. But 9 times out of 10, if you're a healthy man, you're paying most of the bills or all of the bills. You're paying for the food, the trips, the dinners. You're paying for all that. You're paying for all that. But we have to get back. We have to get back to the role of family and even having dinner together. Right? Big Mama, we used to all sit around the dinner table. You had to go to Big Mama's house on Sunday and eat dinner. And that's how she figured out what was going on with her children.
Mm-hmm.
You understand? We don't know what's going on with our kids because we don't take that dinner time to sit down. And it was funny. I was watching. They had the new, what they call it, like the movie promo for the Fantastic Four.
Trailer, okay.
Right? Mm-hmm. The first trailer. And Reed Richards was giving a tour of his building, right? And I was like, wow, he says, and we make sure every Sunday we all eat dinner together. That it ain't no other option, right? So I'm like, oh, okay. So they're showing the family unit of the Fantastic Four. They eat dinner together. Like we have gotten away from that in the Black community. To have that time together and share spiritual energy, share spiritual ideas, talk, examine your children, see where their mind is at, right? Then you don't do it, then you surprised that your child's in a gang, your daughter's going with some dude 20 years older, right? You don't know what's going on because you're not examining, you're not taking that dinner time to examine them.
Mm-hmm.
And foster familyhood, man. We have to get back. We have to figure out how do we get back to that. But there's many layers to that. But I think that's part of health and wellness too.
Mm-hmm.
Family structure, love, attention. Some children are starving from attention,
right.
Because they might not be with both parents. The mother has to work 2 jobs. The child has to get dropped off here and dropped off there and dropped off here.
7 out of 10 kids don't have a father in their home in the Black community.
Exactly.
7 out of 10. So something is wrong there.
Yeah.
Whatever is incentivizing this, I don't know if it's premarital sex. I don't know if it's, people are just repeating what they've seen, right? There's not a lot of, because I can tell you this, I went to college with, a lot of Indians, a lot of Coptic Egyptians, they're the Christian ones. So I was, pretty close to a lot of, a lot of those guys, right? So I've gotten to see their communities up close. As soon as we graduated, man, every other weekend was a wedding, right? It's like boom, 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 boom. I don't know anyone of my friends from any of those communities that had a child outside of marriage.
Right.
I mean, they all just got married. Boom, boom,
Right.
boom, boom, boom. It was just one after another. I feel we were going to weddings left, right, and center.
But we
And
stopped teaching that.
right,
We stopped teaching that. And I say that as a man that has 2 children, and they both have children out of wedlock.
hmm
And we stopped teaching that, because when do we break the cycle?
yeah,
When do we break the cycle? And look, I love my grandchildren, and I look at my children and say, I tried to give you an example, but then you fell into the same predicament. How does that happen?
the cultural.
Exactly. What is the influence? What is the what's even the influence?
I'll tell you what I think, and this is my opinion. What I think the influence is. It is a culture. I heard a great sermon where the preacher said, Satan just has to control the culture. Once he controls the culture, it's on autopilot. No matter
Right.
what the church
Exactly.
does, or you can pray, no matter what, the dominant culture will prevail and will have more influence on your children in the church, even. Because I know kids who went to church with me, and they fell they're in the world now, right? If you control the culture, you can control generations of people,
Right.
right? What has to happen in our community, in my humble opinion, is the culture has to be criticized. But when you criticize the culture, you'll understand the response is you're an Uncle Tom,
Right.
right? So
Absolutely.
you really have to. I mean, there are people out there that criticize the culture and everything, but they're really quickly identified, kind of like a tumor, and walled off, right? Like, nope, we're not getting on this platform to talk about this, even though it needs to be talked about. So I think one of the greatest ways in which, one day soon, when I get a lot of money, one of the things I'm going to do, hire folks from other cultures, right? Like Indians, for example. How many Indians do you know that are divorced?
Right. Exactly.
Think about it. How many Indians do you know that are divorced? Right? How
Right.
many from these communities are divorced or have kids out of wedlock? I don't know any, and I know a lot of them, right?
hmm
Get them to come in and put a show, talk about, the differences in culture, because no one can call you an Uncle Tom because you're not black.
Exactly. You're not black, and you're not, and your culture is different.
Right.
And I think we have allowed other people to dictate our culture.
Yes. And that's another thing. Letting other people influence us musically.
hmm
They control the music. They control,
Exactly.
half the stuff these so-called black celebrities, like a modest black woman, in the hip hop or whatever industry. Where are they?
She'll never make it. She got to get half naked and then
Whole
let
naked,
men.
not even half, whole naked. Because
Exactly. And then what these sisters don't understand, there are men writing their lyrics.
I heard that. Yeah, I heard that. They're not women.
So this is why you're oversexed, because you got broken conscious male rappers or male writers writing these lyrics for these women to influence you on that level. And you just, like I did a small video. I used to work a long time ago. I used to do a lot of security. This is before Giuliani, right? Because when Giuliani became mayor in New York City, the black strip club game was crazy. I used to do security for a company called Erotic Elegance, and they used to do these real, like they used to rent out clubs and do strip parties. Like, it was insane. I got paid. I didn't care. I did security, right? And the owner used to own one of those, those little sex books, with the women in there with the lingerie and all that other stuff, right? It was called Blacktail Magazine. It was real big back in the early 90s, right?
Mm-hmm.
Now, the covers, the women used to wear lingerie on the cover because they were sold in the public, so you couldn't, do the whole nude thing. The nude thing was in the thing, but the covers on the outside, they were women in lingerie. Social media, I didn't realize the social media, and I pulled up the covers. I went online, pulled up all the Blacktail covers. When you see these young girls and older women, when they take these pictures on social media and they putting their butt out and they doing these, those are stripper poses that are on covers. So the whole, we have been in, our sisters and our mothers, sometimes our grandmothers too, have been influenced by strippers. I'm like, yo, that pose you just did that you put on, that was an old stripper pose. That was on Blacktail Magazine. And I did a whole video and I showed the covers. I said, this is how your women pose for pictures.
Yeah.
So that was the beginning of the end, and plus the feminism and everything else. And then, and we're talking about health and wellness. This is a health and wellness show. And then they're also influenced by the unicorns.
What are the
unicorn people? The unicorn people.
The rainbow.
Yeah, right. They're influenced by the unicorn people. Right? Because what look what happened. And I really don't care, because we got to be in the age of truth. Women start dressing like RuPaul, long eyelashes. Because remember, brother, when a man dresses as a woman, he has to accentuate and bring out everything, right? To cover his manlyhood. Now you got women with their eyelashes is like, I was like, what are you, and the weave, and then all of a sudden, everybody want to get their body done. They want to get their butt done and all that has been influenced by a culture that is not healthy, right? So now we just got a culture that needs God.
Yes.
It's a culture that needs God, and then you're taking away, black man's cornerstone is the black woman. I don't care, even in other cultures that they say suppress women, the women in the home is the most powerful.
Yes, of course. Of course.
It's the most powerful. They done beat us up and took our woman. Now we got a hard time getting her back, brother. And that's part of health, man. That is health.
Well, of course, a mother, a father, and their children, that is health. And look, if you take the father out of the home, as is the case in 70% of black children, okay, you and I both know, I don't care how strong you are, this whole nonsense about I'm a strong woman, I'm a strong black woman. I don't know too many Indian women that are saying they're strong Indian women. I don't know too many Arab women that come out and say I'm a strong Arab woman. I don't know Latinas that'll say I'm a strong, independent Latina woman, right? So it's a scam, right? I haven't even heard of a white woman say I'm a strong, independent white woman. So I've only ever heard that context with our people.
Exactly.
Right? I don't know anyone foolish enough to publicly say that like it's a good thing. And there's a difference between having to be, single and independent, not rely on anybody. That is not what God intended. It's
exactly.
Not what the Bible. That's not the outcome of the gospel. But if it's your reality, just because you've gone through it, maybe you shouldn't advertise it. I never want to take advice from someone who is unhealthy. You understand? I never want to take advice from someone who is out of shape, chronically ill, and they're telling me, I don't care what your degree is or what your title is, you're telling me what I need to do. I'm not going to listen to you, right? I can love you. I can love you with the love of the Lord, but I'm not going to listen to you. You do not dictate the terms by which I'm going to operate. I don't know who you think you are or what your title is. It's just not going to happen with me, right? But likewise, we have to apply that same principle to,
Exactly.
where a little girl is growing up, and we show her that, look, you can either have that outcome or you can have this outcome. And the same thing with young men, right? I can tell you this. One of the reasons I got married at 28. Around that time, a lot of my black friends, although many of them are Africans of African origin, we were all kind of like married around the same time, right? And so that's also another factor. Is one of the reasons I'm married is because my closest friends around me, even the black ones, are pretty much all married, right?
Right.
Except for one close one, we're working on him. But we all kind of got married around, one after the other. So that was a part of our culture. So now when we're talking, our conversations have evolved. We're no longer talking about
And that's
sports or whatever. We're talking about, hey man, my child is, what are you doing for your wife? So we're on the same
exactly.
frequency. If you don't have friends like that, then you're never going to go beyond, this single idea of, my baby moms or whatever the term is. And so it's the culture, right, affecting us all, but it's also with just your personal circle. And it gets to the idea that at a certain point in your life, you've got to step away from certain friends.
Exactly. Exactly. Is if you're married, you shouldn't be running around with a whole bunch of single people.
No.
That's just not. It's not. You gotta find. You should be able to find married friends on your level, because what conversation do you have with a? I've got certain close friends that are single or divorced, right?
Mm-hmm.
Or close friends, in my circle that are looking for wives, that want that wife, and and then they're at the level that I'm just not grabbing anyone. I'm trying to find, that mate for me, that help me.
Mm-hmm.
And that's great. But all in all, I'm not hanging out with them every day, all day, because I'm married. I gotta go home. Right.
Yeah.
So and vice versa on the women's show. What do you if you're married, what are you hanging out with single people for? That doesn't mix. I don't care if that's your girl from back in the day or whatever. Her lifestyle is different from your lifestyle.
Your priority.
You can't have a single mind in a married home. It doesn't work.
That's right.
It doesn't work.
It doesn't work. And look, it's sort of like the saying, the blind leading the blind. I mean, where are they going to go? Right? Like, you can't lead each other because none of you know where to go. Likewise, if you want to be wealthy, hang out with some wealthy friends, right? People with,
Exactly.
if you want to be married, hang out with some married folks. If you want to raise smart kids, find folks who've raised smart kids. Find out from them. You get to choose in this life. You get to choose what your future is going to be, and you make that decision right now, each and every day. And so, don't be surprised at where you are 10 years from now, because the seeds of that outcome were planted 10 years ago.
Exactly. Yes, sir, brother.
That's all life is about. You get to pick and choose, what it is that you want out of life. If you choose to listen to some people that tell you that you can't do this because you're this or whatever, if you believe what they say, then that's on you, right?
Exactly.
If you choose in this life, I've said, I will not be a victim. There is no spiritual power or physical power that'll make me a victim. Okay. I serve a God that gives me the strength to overcome anything. He doesn't have to move any mountain. Just give me the strength to move the mountain and I will move it. right? So I choose to live a life where I am not a victim. I am not weak or desperate. I am not poor or destitute, right? I
Right.
aspire for greatness and I aspire for more. And I will get all I'm going to get, right? So that's what, but these are the choices that I made based on what I believe of life, of the purpose of life. And so anytime somebody comes around and they start planting ideas of victimization or victimhood or this, that, and the third, that just doesn't, that programming just does not work for me, right?
Exactly. But black people, we've been taught to be victims. Oh my God, they're cutting off DEI. Oh my God. No, we have $1.5 trillion in spending. Go somewhere else and buy your products.
I'm gonna tell you like this: we could easily colonize a country in Africa. Okay? And I'm not saying it in a bad way.
Right.
I'm saying where you could go in there and I got to go after this statement.
Okay.
I'm saying we could go in there and actually develop the infrastructure.
Yeah.
Okay, just like other people have done. Chinese have developed China. These people have developed Dubai. We could look at there's 50 plus countries in Africa, 60 plus countries. Pick one. Okay, go there, invest in it, develop it, boom, 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 turn it into a first world country. And now you will own the wealth. Somebody has to dig up the minerals, right? Somebody has to have
Right.
So everything that other people have done, we can do.
We could do it, bruh. We could go in the Midwest and do it here.
Right. We could do it in the Midwest here. But I'm saying if you wanted to start
right.
like the concept of race, the white ain't no white man there. Okay.
Exactly.
Blacker than you are. Okay. Let's
exactly.
hear that the white nope. These people are blacker than you. Okay. So you the white man when you go over there, if anything, right? So but you realize that, man, you like you said, you could go in the Midwest, right? There's a lot of land out there.
Exactly.
But everybody wants to be in one place, right? Nobody wants to, okay, there's no jobs here. Maybe that's a sign for you to move. So these are things that we have to deal with. That these are opportunities that are there now, right? That they're there now. Every now and again, I go online and I see folks, Black American folks who move to Africa. They move to Ghana. You look at
a lot of people moving to Ghana.
You look at the way they live, and they're rich over there. I mean, these are middle class folks. They are well, and it makes sense because the average African American is the richest Black group in the world. I mean, you're struggling here, but you're a multimillionaire in Cameroon.
Right. Exactly.
Right?
Exactly.
So,
exactly.
If life is so bad here, my brother, you can go and live like quite literally a boss in these other countries. And having said that, brother Damon, I gotta go.
No, thank you, brother. Thank you for your time, man. Thank you for your time. It's always appreciated. Before you leave, just tell people how they can reach you, and tell people how they can reach you if they want to contact you.
Yes, sir. So my name is Dr. Cedrick Batchateu. I'm a hugely passionate man when it comes to chronic disease prevention. So as you can see right behind me, there's a copy of my book, Self-Care Advocate, 7 Steps to Prevent Chronic Disease. It's 5 stars on Amazon. So you can just go on Amazon or you can go on my website, drced.drced.com. And if you're a physician and you're watching this, I have a chronic care management business, which can help set up your practice for value-based care. You can visit and learn a little bit more about that on chroniccare.net. We can give you a free analysis of how much reimbursements this program can get you, how much additional revenue you can get. So pay us a visit at chroniccare.net. Thank you.
Thank you, brother. Thank you once again, man. Thank you, man. That's Dr. Cedrick, friend of the show. He's always been here, man. Enjoy and thank you, brother. Thank you.
God bless. Bye-bye.
So thanks, everybody, for watching. And please like and share. The show was only going to be like an hour, but we got into some real deep conversations. I love having this brother on. I love having the conversations with my brother. You could watch. You could also go to Black Westchester on YouTube and watch the full hearing for RFK. Let's remember, we have to make health and wellness the new black. It is our responsibility to stay healthy. is nobody else. We have to take our kitchens and make them medicine cabinets, make them a place of health and wellness and spirituality, and not a place of sickness, disease, and death. So until next week, I thank you. Have a blacktastic day. And remember, God is in your vegetables. Peace out.
Thank you for joining us on another episode of Wellness Wednesdays. If this information resonated with you, please hit that like button and share with someone who needs to hear this message. Subscribe to Black Westchester's channel for more content focused on our community's well-being. Remember, while Damon is certified in holistic health and wellness coaching, always consult with your healthcare provider before making any